one of the biggest and most cited, I guess, concerns that we hear about the U.S. national healthcare system is how much we spend. So this was taken from, I believe it was the CDC. Uh, I mean, it's a very public number. In 2017, it was $3.5 trillion what we spent on healthcare, and it was $10,000 per capita, meaning per person. Now, this is the most. This is the we're one of the countries in the OECD, which is the developed countries that spend the most, but is targeted for, or is highlighted as providing the least effective care to our community or to our public. Now, some of the um, some of the facts that were, this is from the Department of Employment fact sheet. Yeah, so the references and the citations are further along at the end of the lecture, and I can provide you the articles again, as I've said earlier. So some of the things that have been noted as causes for such high and extreme expenditures are the rising costs of healthcare. So not only doctor visits and how much doctors charge, but rather that the technology has gone up and advances, and so those are like really runaway prices. Prescription drugs. This is something that's actually unique because in other countries, prescription drugs are quite cheaper, and it may be due to the FDA and how they control the research and the I guess, availability of the drugs. And then, but also one of the biggest is administrative costs. And as you can see here, it was estimated that $361 billion was spent annually on administrative costs. And it's not that it was just spent and that it was administrative costs, but that it was wasteful. Um, this is a huge amount to just be wasting, and we can probably do a lot better. Now, considering that it's administrative costs, we would assume that most of this is bureaucratic, right? So we are taking into account that this is Medicaid, Medicare, ACA, the veterans. All of these have so many levels and so many dimensions in the hierarchy system, and so many bureaucratic, ineffective communications, that it costs all this amount of money. And in with respect to the conversation coming from a free enterprise point of view, the number one thing that you would try to do is cut costs. So the argument from the free enterprise is that, well, of course, administrative costs are high because there's no incentive to cut the costs from the company who is administrating the business. Because if the business were in charge, and in a free enterprise system where it had to sustain itself through being profitable, it would surely make sure that it is not having $361 billion in wasteful product, or it would fail. The system would be allowed to fail. So this is, in citing free enterprise systems, these are one of the things that we have to keep in mind when we're comparing it to, let's say, social systems. This is something, again, that I heard Milton Friedman say, and it makes total sense, and it's something that you come to on your own terms, but you also when you hear it come from such an authority, because he's done so much research and provided so much to that field, that it substantiates the claim that one of the biggest advantages of this free enterprise system is failures. Is that when companies are allowed to fail, bad products and bad services are eliminated, as opposed to the bureaucratic system or systems that are public or government funded. The government tends to not cut its own departments, of course, because it has many incentives not to do so at every level.